You're live.
Hello, you guys, and I am Dr. Vidal, and we are back with Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. Thank you for joining. Thank you for the support every week. This week, we're going to talk about a special topic that's breastfeeding and breast surgery. Why is it so important to talk about this? Well, majority of patients that get a surgery with a breast implants are actually in the reproductive age. So the 60% of patients that we put implants in are between the ages of 19 and 34. So this is a very, very important topic. Why? Because a lot of patients have the concern, if I put the implants, then can't breastfeed? What are the risks involved? Some patients think that if they need a breast lift, the nipple is going to be taken off their body and put back in, and that's going to affect their breastfeeding ability. So we'll talk a little bit about all of this. And also for moms that have been breastfeeding, well, breastfeeding affects the shape of your breast, and a lot of those patients are interested in getting reshaped volume, and the question is when to do it. So we'll go over that as well. Let's start with the first part, right? Like if you are interested in breast surgery or breast implants, does that affect your breastfeeding capabilities? Or you need to decide whether one or the other? No, not really. So we're gonna go over this article. This is from the Aesthetic Journal, the most important aesthetic journal, plastic surgery worldwide. So it was published last year, and it's a meta-analysis. With what it means, it reviewed all the articles that have been published in the literature, comparing females that had breast implants versus females that did not have breast implants and their ability to breastfeed. And we can talk with numbers because experiences and patients that had done this and can tell you what their experience is, it is valuable. But when we're taking a decision that involves surgery and implants, you should go with the numbers. And I took the numbers from this article, so we'll go over that I put it down here, okay? So first, it evaluated, there are 11 articles that were found in the literature talking about breastfeeding with and without implants. And of those, there were 8 articles that discussed just breastfeeding of patients that had implants. And these are the numbers that they saw. So 82% of patients that had implants were able to successfully breastfeed. So the majority of the patients with implants were successfully able to breastfeed. What is successful breastfeeding? So that involves everything, right? It's not exclusive breastfeeding. It may involve adding some formula or substitute, supplementation. So of those 82%, 33%, so 1/3 of those 82 that were able to breastfeed with implants needed to supplement. So one of the things I always explain to patients that are young and are undergoing either a breast augmentation, breast implants, or breast lift with implants, or a breast reduction, is majority of patients are able to breastfeed, but there's a significant amount of patients, 1/3, that need to supplement, okay? So if that is extremely important to you, that your baby is exclusively breastfed maternal milk, then you may consider to wait, okay? Because you may need to supplement, and that is because different things affect the productivity or the ability of your breast to produce milk after having implant surgery. One of those is the surgery itself. There's a scar involved. There is, depending on the approach, some of the milk ducts can be severed with the application of the implant. So for example, if you're having a breast augmentation through the nipple areola complex, that is a higher risk of then cutting those ducts and to put the implant in. If we're doing a breast augmentation from the lower pole, then you may not need to get in the breast parenchyma, so the risk of injuring those ducts is less. So one of those is the surgical the surgical injury of those ducts. In a breast reduction, we are removing breast tissue. So if you had 100 glands and we remove half of those, then you have 50 glands to produce the milk. So yes, you're going to produce less milk because there's less breast tissue present, okay? The other concern with breast implants is the pressure. So with the implant, we add volume and it gives some amount of pressure to the breast parenchyma, and that may affect the productivity of the milk. And the other one is because of the stretching and also surgical trauma, the nerves may be affected. So you need some stimulation. Baby attaches to the nipple, that creates a reflex on our nerves that stimulate the milk production to come out. So because of the surgery and the stretching and the implant there, all of those things may be affected. But the good thing is the majority of the patients are able to breastfeed. So what also is important when we talk about breastfeeding, mastitis, okay? Mastitis is an inflammatory reaction or an infection of the breast parenchyma when you're breastfeeding. It is caused by obstruction of those ducts, gets clogged, that gets swollen, it starts with a mastitis, it may progress to an abscess, right? So why it is important, because if you have an implant there, then people are scared that if I get an infection, the implant gets infected. So all of this, it's good to consider. But the good thing is there's not an increased risk of mastitis with patients that have breast implants, okay? The normal rate of mastitis with breastfeeding females is 5 to 8%. In the studies with breast implants, it was 6%. So it's within the normal rate of mastitis. So breast implants do not increase your risk of having mastitis when you're breastfeeding. And the other one is excess pain. People are scared that I have an implant, it's gonna be more painful for me to breastfeed, and it's only 4%, okay? Very, very low rate. There is, in that article, they mentioned that this may be contributing to the majority. There is an increased percentage of patients that have breast implants and decide not to breastfeed. That's another different thing, right? Breastfeeding, it's completely optional. It's mom's decision and mom's decision to feed the baby. And for all moms out there, and I heard this, and probably all the moms out there have heard this, fed baby is a happy baby. So it doesn't matter if you're giving them breast milk or formula, a fed baby is a happy and healthy baby, okay? And sometimes for mental health of mom, breastfeeding is not an option, right? And that's okay. But I just wanted to discuss what things can be, you have to consider when considering a breast surgery, when you are in this age range that you can be reproductive and breastfeeding is important to you, okay? So there's another article that was interesting, because this article's up here was just looking at patients that had breast implants and then breastfed, right? But what about if we compare both groups? Let's compare a group of women that have breast implants and breastfed with a group of females that just breastfed without implants. And let's see the numbers and let's see how it looks. So implant and breastfeeding, exclusive breastfeeding was 67%, and the no implant with breastfeeding was 81%. So it was a little higher, like I mentioned. Exclusive breastfeeding, this is no formula added, completely breastfed mom milk. It is higher if you don't have implants, so something to consider if you really, really want to breastfeed your baby. Successful breastfeeding is including both exclusive and supplemented with formula. It's very similar, 72 and 88%. Because remember, not everyone is able to breastfeed, even if you don't have implants, okay? There is a 5% of the general population that just don't produce enough milk to breastfeed, right? So that's important to take into consideration as well. So the numbers are there. The numbers are good in the sense that majority of patients are able to, and majority of patients are able to exclusively, so more than half were able to exclusive breastfeed. But yes, if that is very important to you, then it may affect your decision for surgery. What about the opposite? What about, I don't have implants and I'm breastfeeding my baby. When can I have breast surgery, right? The implant, what does breastfeeding do to our breast? So basically, there is an engorgement involved. It stretches the skin, and then when you stop breastfeeding, everything deflates. Those glands then deflate, and you may then turn into the fibrotic tissue or dense breast tissue turns into more fatty tissue. So you see that your breasts at first were very round and perky, and after breastfeeding they look kind of deflated and that skin kind of sats, and that's what's called ptosis or droopiness of the breast. Okay, so when can you decide to have your breast procedure? So it's very important that you stop breastfeeding 6 months before having your breast procedure. Why? Because we want all those glands to deflate, not have any risk of infection with that milk there, okay? There are also risk of kind of stimulating that milk production again with the surgery, and then having leakage of breast milk after the surgery if we do it too soon, or create what's called a fistula. So all those ducts that were cut during the surgery may start to leak through the incisions, okay? So it's better to all those glands to dry up, all that tissue to kind of regress, see how much your skin retracts and redrains, and then we can make a plan for you, okay? So 6 months after finishing breastfeeding, okay? I'll take some questions now.
Okay, here is one from TikTok. Is it general anesthesia safe?
Yes, very, very safe. Of course, we need to check a lot of things before putting you under. So your medical evaluation before the general anesthesia is actually the most important part. We need to check that if you have any medical conditions, they're well controlled, that you don't have any cardiac complications or issues, that your lungs are clear. So if you're smoking, you need to stop smoking at least 30 days before your surgery, okay? Your blood work needs to be up to date, and your electrolytes. So all of that's very, very important. If all of that is controlled and you're a healthy young individual, general anesthesia is very, very safe.
Can I have color gel on my nails when having surgery?
So the most important, two very important things about this topic. One is the color and the thickness, right? Because why we want one nail to be out? Because we want to monitor your oxygen levels, okay? So we put what's called a pulse oximeter, and that kind of reads through the nail bed to make sure that we're checking your oxygen and heart rate during the surgery. So if the nail is too dark or too thick, that sensor can be affected and can affect our ability to monitor your oxygenation throughout the surgery. And the other very important thing is the length, okay? We don't want a clear nail, but the nail is like this and I can't put the pulse oximeter, okay? So trim your nail and very, very light color.
Okay. Well, this is not a question, it's just a comment. I'm fat.
Okay. There's options for you. If you want to we're in January. You can take your life around and change it, and then by the end of the year, you can be very happy for your transformation. A lot of options. We have an injectable available for weight loss, so if you're interested, send us a virtual consultation form and we can tell you all about it.
Okay. Well, this is about this topic, and
Okay.
it's, will you be able to breastfeed after a lift?
A breast lift, yes. So we go over these numbers. This is basically more implant related, but it is included in all those studies about breast surgery itself. The risk with the breast lift is that cutting of the ducts. So the nipple with the breast lift is not cut and replaced. It's kind of turned over, okay? So those ducts are still preserved. So the majority of patients are able to, but it may affect your milk supply, so you may need to supplement.
Well, you answered the question of her, and she said, "Thank you. I can wait until see you in June."
Awesome. Can't wait to see you too.
Okay. Let me find. This is related to the topic.
Okay.
I got surgery in 2019.
Okay.
So I'm ready. Yes, she's ready. It wasn't 2019, I guess. Breast implant.
Breast implant for breastfeeding?
Yeah.
Yes, 100%. I was expecting the question to go a little bit longer.
Yeah.
Like,
it was more like a comment. It was
yes.
a comment. I'm a patient from Canada. Do you receive out-of-town patients?
Yes, we do. The only thing that's different is The blood work. So we'll need for you to have blood work done home to make sure that your blood work is up to date. But there's some differences in the laboratories and the measurements between international and US. So we ask you to come a few weeks before the surgery and have the labs redone here. So we do fill a virtual consultation form and your coordinator can explain the entire process to you, but we do have I've had a lot of patients from Canada, so it definitely can be done.
The same patient. When I can travel back?
So like I mentioned, you'll have to come before the surgery for the blood work. After the surgery, you have to stay here for at least a week. So I'll see you the day before the surgery, then surgery day, and then you have to stay until post-op day 5. Post-op day 5, I see you, I make sure that everything is good, and if everything is good, you can travel back home. So more or less, it's like 7 days here.
And just to wrap, like a lot of questions about consultation and prices and schedule, how they do that.
So very easy. Go to my my bio, or if not, pureplasticsurgery.com. That's our website. You click there and you'll see request a consultation or virtual consultation form. Even if you want to have an in-person consult, that's the first step, okay? So you go there, you fill in some basic questions, what procedure you're interested in, and also we ask for 3 pictures. I evaluate all that information, and with that initial evaluation, a coordinator calls you and she'll explain the entire process. Awesome, guys. So thank you so much. Hope this helps for all those mommies out there that have a lot of questions regarding breastfeeding. If you have any topics that you want me to discuss, please DM me or put it in the comments, and I'll see you guys next Tuesday on Tuesday Tips, okay? Take care.